Good afternoon, everyone. Today we're going to be talking about the importance of pharmaceutical care. I know that will count as an introduction to our class, which basically is going to talk about different cases in first aid and in how to manage certain cases. Let me first talk about our presentation will involve patient-centered care, and I'm sure that you already have certain information about this. The goal of pharmaceutical care, what are the goals of pharmaceutical care, and how the process goes about pharmaceutical care, the primary elements for pharmaceutical care, pharmacist's responsibility, and drug-related problems, different types of them. And then we're going to talk about the importance of patient assessment in providing full pharmaceutical care to our patients. Let's start with this question. What do we mean by patient-centered? Patient-centered. What's the meaning of patient-centered?
Focus on patient.
Focus on patient. So basically, everything we do, the patient is the goal, and it's in the heart of each process. How can we do this? By first partnering with the patient. So we basically have to be partners, shuraka, with the patient. But not only partners, we should be leaders in this partnership. We should be the one who is mentoring the patient, who is leading the patient toward better health. We need to engage our staff. A big problem pharmacists do is basically they work everything by themselves and they do not include their technicians, the people who help them. And that makes the load very high on pharmacists, and then they cannot really do what they are supposed to be doing. We need to involve the patient. Think about it this way. If you are going to be told what to do, you're not going to do it. You're not going to do it. What مديرك في العمل or your superior, even your parent tell you something to do, sometimes you're hesitant. Do it or not do it, right? But when you are engaged, when you are part of the decision, then you will do it. Then make sure that your patient and their family member are part of the decision making. Make them accountable. Very important to it. You know what accountable means? Responsible. Accountable means responsible. So you have to make sure that they are responsible for their actions. Make them feel responsible. Enhance the improvement and improve outcomes. What's the difference between goal and outcome?
Goal, something I want to do.
Exactly. Outcome, what you have done.
Result.
Exactly. What's the result? I want to make $5 million. I'm done with $10,000. That's what you start. You start very big and you want something really huge, and then you end up with something as a percentage of what you have done. Why do we do pharmaceutical care? What's the goal of pharmaceutical care? First of all, to cure the disease. But are all diseases curable? هل يمكن الشفاء من جميع الأمراض؟
No.
Diabetes. Can someone get cured from diabetes? No. Can someone get cured from hypertension? No. So the first goal is not always attained. We cannot reach the first goal. The second goal is either to stop the symptoms, make the patient without symptoms, or reduce the symptoms, make them less. We need to arrest or slow the process, the disease process. How do we do that? Can you tell me an example about what we do to reduce or to stop the disease process?
Vaccination.
Vaccination is this one, prevent. But all the new drugs, the genomic drugs for
anti-hyperglycemia or there's a question.
Anti-hyperglycemia, it's more about actually the new drug, the TF1 for arthritis, for example, for rheumatoid arthritis. We need to slow the degradation of the joint. That's one example. Or to prevent a disease or to prevent a symptom. Prevent a disease, vaccination. Prevent the symptoms, if you remember from last time, to give someone an antiemetic before a chemotherapy. So they do not have emesis. After all, what we really do is basically to engage our patient as a team. We are part of the team. Pharmacists do not work alone. They work with other pharmacists, with other healthcare providers, and most importantly with the patient. Patient is very important to be involved in that process as well. How can we go through the process of pharmaceutical care? Am I being simple? Everybody understands everything?
Okay.
Don't be shy, please. There's no shyness in knowledge. Shy, as I said, I'll repeat. Pharmaceutical care process, first you need to initiate a relationship. We call it a professional friendship. Why is it professional? You know what professional means? Why is it professional? Why? Why it's not like just a normal friendship? Why it has to be professional?
Depends on my knowledge to teach my patient.
Exactly. And you want to keep that line between you and the patient. You don't want just your friend so they don't listen to you. You want to be always a mentor too. So you are their friend, but the friend who accepts his advice and listen to what they tell them to do. And sometimes the patient cannot take care of himself or herself, so we ask for a caregiver, very importantly. Gather information, and we have two different types of information. Do you remember that?
Yes.
From basic clinical pharmacy? What's the two types of information?
Subjective.
Subjective?
Objective.
And what's the difference between subjective and objective? Subjective means?
From patient.
Yeah. Patient is saying, راسي راح ينفجر. صح? Is it really going to explode?
Yes.
No. But that means he is in great pain. You cannot measure that. Different response to pain is different. People have different responses. What makes it easy for you, some people would be crying on it. So that's subjective. What do we mean by objective information?
Blood analysis.
Exactly, blood analysis.
Specific.
High glucose,
Blood pressure.
hypertension. His blood pressure is 140/90. That's high. So that's objective, we can measure. And now we need to assess. And I remember that I told you the difference between assessment and evaluation. Anybody remembers? The difference between assess and evaluate.
Evaluation after assessment.
Evaluation after assessment. So you assess, you give a treatment
Yes.
or a plan,
Yes.
and then you evaluate the plan.
What I have to.
Pharmaceutical care plan, we're gonna have, even in first aid, even in emergency situation, there should be a plan. And we're gonna talk about this later, what we call the golden hour and the platinum 10 minutes. You need to make a plan in 10 minutes and start doing it. Complete intervention. What do you mean by intervention? Intervention. That's what pharmacists do, right? They intervene.
Engage.
They get engaged. They get involved. They are part of the process. They do something. They don't just watch the patient. They do something actually. And then you have to implement this intervention. And implementation is the most important part. We have, I told you before, we have the best tools in the world, right? But what's the problem? We don't implement them right. And we need to follow up on the patient, and that's what we discuss. That's evaluation, right? Now, what are the primary elements? Why do we do pharmaceutical care? Very basic question. If someone asks you, I noticed a lot of questions the other day asking about PharmD. Everybody wants to be a PharmD, right?
Yes.
Everybody wants to be
Yes.
clinical pharmacist. Why? Why? What's the big deal with clinical pharmacy? What's the most important? Why is it important?
To
Read this. Anybody wants to read?
the needs of
The society needs, because too many drugs, too many problems. You look at your grandfather or grandmother, each one of them is taking 10 to 15 drugs at least, right? he or she has at least 2 or 3 diseases. Too many problems are resulting. Who's gonna identify and resolve these problems? Pharmacists. Patient-centered approach. In the past, I said before, medication was the center of the pharmacy profession. We cared about the drug, how to make the drug, how can we make the drug stable. That's what you study in pharmaceutics, right? How we can make it easy to take, how we can make it taste well. That's not anymore. What we care about is the patient, and the drug is just a tool to make the patient feels better. I don't care about making the greatest medication. I care about making a medication that this patient will take. A practice based on caring. You have to show caring. You cannot be just very cold. Like I see it sometimes in pharmacies and everywhere in the Arab world, right? What do? You come to the pharmacy, يجعني راسي بنادول. ما نفع ibuprofen. You don't even listen. You don't sympathize with the patient, so you don't show any caring approach, and that's very wrong because patients will feel that they are strangers and they will not really tell you what they have. Responsibility for finding and responding to patients. You have to know DRPs, and we said we have 2 different major types of DRPs. Anybody remembers? Actual DRPs and potential DRPs. Actual DRPs, the patient is suffering from now, and I think if you continue on this plan, you will suffer from future DRPs. So, what is our responsibility? First, are the pharmacists responsible for the drug they provide to their patients? When you go and someone is asking you, give me amoxicillin 10 capsules only. I only have enough money for 10 capsules. Do you give them 10 capsules? And if you do, you are responsible. It's not a matter of money or what you can afford or what you cannot afford, but these 10 capsules will not really help the patient. It will make him worse. So it's a waste of money and medication.
And to make resistance. And to make resistance.
Make resistance makes it even worse. That's exactly right. The first statement is what pharmacists do. Anybody wants to volunteer to read for us? What does the first statement say? What does the first statement read? Read it? Read it? No. Go ahead.
To ensure that the patient drug therapy is appropriately indicated, the most effective available, the safe possible, the most convenient to take, and the most economical.
5 things. First of all, it's appropriately indicated. The right drug for the right patient for the right indication. Second, the most effective available. Yes, this drug is good for you, but it's not the best. I want to ensure that this patient has the best treatment. Yes, it's not safe enough. Too many adverse drug reactions. Too many problems associated with the drug. Most convenient, you give one person who will not take injectable medication, you give them an injection. Will they take it? They will throw it on the shelf, right? The physician will write a prescription, the pharmacist will dispense the prescription, but that doesn't mean that the patient will take it. Sometimes they won't take it at all. And the most convenient and the most economical. If I tell you, if you have a flu, right? You have a flu. And I tell you, I can make you get rid of this flu in 2 days, right? But the medication will cost you 2,000. Will you pay 2,000?
No.
Yeah. I can wait a week and it will go on by itself, right? I won't pay 2,000. But if I tell you 50, you might think about it, right? If I tell you 20, oh, sure, I'll pay for it. So it has to be economical, it has to be affordable. Then to identify, resolve, and prevent, and that's what clinical pharmacists do. And then to ensure that the patient's therapeutic goals are met and the optimal outcomes are attained. We have 2 things. We have our goals and we have the patient's expectations. Can anyone tell me about the difference between our goals as healthcare providers and the patient's expectation? Go ahead.
The share point, the cure of disease.
That's, you want to cure the 5 goals, the 5 main
Yes.
goals that you mentioned, right?
Yes, and
Cure,
the patient.
reduce the symptoms, prevent the disease, stop the process of the disease. These are our goals, right? What are the patient's expectation? What does the patient want? Really?
Disease gone.
Yes, but why does the patient wants the disease gone? So he can go back to work. So he can do his normal life. So you can tell him, maybe the disease will not gone, but you will not be in pain. Oh, that's good. Then I will, for example, walk without pain. I can go to the bathroom without help. I can feed myself. I don't need someone to feed me. That's good. That's what they really want. They don't care if the glucose level is high or down. They care about they doing their everyday life. And that's what you need to do. You need to make that match between your chemical and your outcomes, your goals, and what the patient wants in their daily lives. True? Yes. Drug-related problems. I know for a fact that you all know what drug-related problems are. So, what's a drug-related problem? In general.
Side
effects.
Side effect.
Drug interaction.
Desirable.
Drug interaction. Drug-food interaction.
Uncomfortable.
Inconvenience. Incompliance with the patient. Drug-disease interaction. True. There could be another disease that you cannot take this drug with. So it's basically any undesirable event experienced by the patient when they take this medication. The types, we all know the types. I put them in this table so you can know what could be the causes for unnecessary drug prescribing. Can anybody tell me about a person who may take a drug that it's not indicated? What are examples? Someone takes a drug and this drug is not needed. Give me an example.
A mistake.
By mistake, for example?
Child.
Yeah, like if when patients, for example, ask their neighbors, right? What's the best thing for my child? And they tell them, oh, this worked for my child, try this. But it's different indication, right?
Wrong diagnosis.
The wrong diagnosis, for example, by the doctor, could be. Or it could be another thing that sometimes they are taking a medication, like it happens a lot when you change, for elderly people, when they change their heart doctor. They go to one doctor, he gives them, for example, losartan, right? And then they go to another doctor, and he writes Diovan, and the patient will be on losartan and Diovan at the same time. The doctor forgets to tell the patient you have to stop the losartan, right? So they could be on duplicate therapy. Wrong drug. Woo. Examples. What patients taking wrong drugs?
Like antibiotics with
Maybe
flu.
it can be from your daily life. Like you know about a friend or a family member who was taking a wrong drug for some time. You've never heard of this happening before? Yeah. Like what would be the case? Taking antibiotics for the cold, right?
Yes.
A lot of people, they are sneezing, they go take antibiotics. They think that's the right drug. It's wrong. There's a contraindication. Some people are taking, for example, aminoglycosides, and they are, like the example the pharmacist mentioned, and they are underage. They are under 15 years of age. Wrong contradiction. Could be another drug that's interacting. Dose too low. I've noticed it yesterday. I was working in the pharmacy here, and this person comes and he said yesterday he got omeprazole. Last week he got Nexium. Today yesterday he wanted pantoprazole. So wait a minute. The doctor told him that since the Nexium didn't work, esomeprazole did not work, and for 1 week, Then he tried omeprazole. Omeprazole didn't work for 2 days, so they changed to pantoprazole. What are we doing here? Was that the best option for the doctor to do? No.
No.
What's the better option? Tell them to take Nexium instead of 20, 40 milligrams first, then switch to another medication, right? But he's switching before trying a higher strength. Maybe the dose is too low, that's why the medication is not working. So if someone comes to you and tells you, oh, this medication is not working, I want another one, I take it properly. Is the dose right? So, dose too high, too many problems. Same thing, adverse drug reactions. And I need to refresh your memory and ask you what's the difference between side effects and adverse drug reactions. So
Side effect predictable. Adverse drug reaction.
less predictable.
Not.
That's right.
Not.
Less predictable. Very uncommon. Very uncommon. It happens, but very uncommon. And then we have non-compliance, and that's the problem with the majority of people. Like, for example, a lot of people would come to you and say, oh, this antibiotic, my clarithromycin, is not working. By accident, clarithromycin. Why? What do? I take it every day in the morning. Exactly. What do you eat in the morning? Oh, I drink a cup of milk. It's not gonna work.
Interaction.
Yeah, so it's not gonna work. Non-compliance. He's not taking it properly. Or sometimes when a pharmacist writes, take it twice a day. He takes one at 8 o'clock, one at 10 o'clock. Non-compliance. Right? Additional drug therapy. There's a problem, untreated. There is a synergistic therapy needed. We need another medication. That's what it means. So we went through this, so I'm gonna go quickly. So in order for us to be able to provide pharmaceutical care, what do we need to do? From that process. Make friendships, collect information,
Good knowledge.
good knowledge. How we're gonna apply this good knowledge in knowing the case. What's wrong with this person? Because half of the solution is knowing the problem. Sometimes wrong diagnosis, as you guys mentioned before, can lead to terrible results, very bad results. What do you mean by patient assessment? What do you mean by assessment? What do you mean by assessment? Now, we said it a little earlier. What do you mean by assessment? Assess.
Gather information.
You gather the information. Now you're assessing.
Not sure.
This could be this. This could be this. A person is coughing and have a hypertension. Has a hypertension, right? Would you give them cough medicine?
No.
No. You think first. Are you taking ACE inhibitor?
Yes.
Maybe if you switch the ACE inhibitor, the cough will stop. That's it. You don't have to give. If you want to give, for example, a decongestant, would you give it to a high blood pressure person? No. Give them antihistamine instead. See, that's assessment. If you forget one part of the knowledge, you don't include it in your assessment, then the diagnosis falls. You need to make decisions. That's very important. I told you the first time I saw you last semester, we are too bad in making decisions. We let the situation makes the decision for us. We don't make any decisions. What was the last decision you made lately, other than coming to school here? I mean, this morning. What was the decision that you really planned for? Very unusual, right?
For what?
To make.
For what?
Anything in life. What kind of decision? Did you make any decisions lately?
In future, At the future.
And you planned for them.
Sure.
That's good. So that's the right thing. That's what we need to assessment for, to make decisions. So when you assess the status of the patient, this patient is sick or not? Is he critically sick? Is he stable? Is he unstable? That's what we need to know. Drug therapy. What kind of drug therapy is taken? Interventions that can help. And problems and future problems. And then the follow-up. The follow-up is very important. Like sometimes I see, and that's example that was given to us also in that meeting. Someone comes with a prescription to you and you tell you, go back to your doctor. This is not a good thing to do. You know what? Once you make this patient feels less confident or inconfident with the doctor, then he will automatically feel inconfident or less confident in you and in the whole health system. Even if the doctor makes a mistake, don't let the patient know. Talk to the doctor. You have a telephone.
Yes.
Call the doctor yourself. Don't send them and tell them this drug is wrong. Because the patient, and you remember what was the response for the patient? Oh, this doctor seemed to know nothing. That's what the patient said. Is that really what you want the patients to think?
No.
That we know nothing? No. Talk to the doctor. Are you sure, doctor? Is that the right thing to do? You know, did you really review that point? That's okay. But don't let the patient be your proxy. A pharmacist cannot adequately provide pharmaceutical care without assessing. Because if you don't know, you can't solve. You don't know the problem. You'll probably be solving another problem, and that's not right. You need to ask questions. And that's something I don't see here. You need to ask more questions. Why? How? These kind of questions. Because once you ask more questions, then you can know more about the person, and then you can have better interpretation. Documentation. It's the very most important piece of things. Write things down, everything. Because you know when you write it, let me have this example again. You call the doctor, this medication cannot be given to children. Are you okay with giving this medication to children? Yes. The doctor said, yes, go ahead and give it. What do you do? A lot of pharmacists say, I will not give it. Go to another pharmacist, right? Totally wrong. You know what that means? You are withdrawing from the responsibility. You're running away from the responsibility. But that's not what pharmacists are about. We are responsible people. We take responsibility of action. Not only our action, but the whole team action. So after the doctor said, no, I want this medication to be dispensed to this patient, although the warning that you gave me, you write this down on the prescription. We call the doctor on that date, on that hour, and he said to go ahead and dispense the medication. Something wrong happens later. This is your proof. This is your legal record. I notified the doctor, and the doctor said go ahead. After all, it's the doctor's decisions of what therapy they want to give to their patients.
What about the patient?
What about the patient? You have the documentation. You tell them, if you start feeling these symptoms, then go back to your doctor right away. And you make sure they understand all the symptoms. So but you don't tell them, oh, your doctor is a nuthead. He doesn't know anything. That's wrong. That's very wrong. Communicate essential information by writing down. If you don't write things down. And another thing very important, you work in a pharmacy, a patient comes in. Every time he's going to tell you his life story. But if you have a certain level of patient profile, you tell him, oh, how is your cholesterol doing? This pharmacist is really good. He remembers that I have high cholesterol. You don't really remember, but it's all in the system, right? So you can read and tell them. They feel more caring. So documentation is very important. Everything, write it down. Characteristics of useful patient record. You write notes, you write notes. What's the most important when you write these notes? How they should be?
Short. Short as possible.
Short as possible, exactly. Oh, I would say concise. Means short and can understand it, not just short and understandable. So use terms that all other pharmacists can understand. So if another pharmacist comes in, can say what's wrong with the patient.
Fix it.
Another thing, they have to be organized. Like if this slide was a word here and a word here, would you understand anything of it? It has to be neat, it has to be organized, it has to be in good shape. Easily understandable. Assessment of the patient, your assessment, and why did you assess this patient this way? Very important. And a plan for the future. And that's what we call SOAP. There are computer softwares now that you fill for every person. Subjective means what the patient is telling you. Objective, what's the lab and the clinical assessment is telling you, the clinical examination is telling you. And then what do you think? What's the case? That's the assessment. And what's your plan for this person to be in better shape? That's the plan. So you write everything down, you go by the patient's name, you can tell everything about this patient's case. I won't go through this, it's already gonna be the slide because you already know what subjective and objective and assessment and plan means. But let me do in this coming 5 minutes, this little quick case so it refreshes your memory for next time. This is the information that we have for this patient. Her name is MH, female. She visits the pharmacy on 9/2/2014, a year from now,
Okay.
next year. She has hypertension and atenolol and captopril, that's the medication she is taking. What's the missing information? What's an important information that's missing from this profile?
The age.
Age, very important.
Yes.
Why is age important? Because without age, I cannot tell what? If the dose is right.
Yes.
What type of
Type of drug.
What type of drugs that is,
Yes.
can this person take? What if this patient is 14 years old?
Yes.
What if she is 84 years old? I
type
don't know.
hypertension?
So that's a missing piece of information. I have to ask. The previous pharmacist wrote this, he forgot the age. So I need to ask about the age. The subjective, that's what the patient is going to tell you. The patient is picking up her ethanol prescription. She's saying, I have head lightness, weak, and she cannot balance for the last 2 weeks. What she's taking, atenolol, you know what BID means? Twice a day. What is it prescribed? Once a day. So she, instead of once a day, she's taking twice a day. She is doubling up the dose. So that means, could that be the reason?
Maybe.
Atenolol is a beta blocker. What do beta blockers do?
Weakness.
Weakness, why?
Because
They slow down the heart, right?
Yes.
And they decrease the blood pressure too much, so that's why she is dizzy. She cannot keep balance. So that's the objective. You measure the pulse, 48, too low. You measure the blood pressure, too low. So that's basically what the problem is. What's your assessment? Bradycardia and hypertension related to overdose of atenolol. What's your plan? What are you going to tell her to do?
Correct the dose.
Correct the dose, go back right away the next day, or you need to take time? Next day, right?
Next day, yes.
But if you're gonna stop atenolol, can you stop it all at once?
No.
So it's difference between dose adjustment,
Yes.
especially at this low range, and stopping the medication, and that's what the plan is about. Okay. Now, I sent this, and I will do the same. I sent this presentation link to Anas, right?
Yes.
And you all guys have it now?
Yes.
Okay. My